My name is Nakia Dawson, and this is my final project. Starting out with occupational therapy scope of practice. I'll begin this one with reviewing medical history. No matter what healthcare profession you are, and as a healthcare professional, you would be reviewing medical histories of patients just to see where they're at or to see what's going on with them before they come to you, what to expect from the patient. And then secondly, conducting an evaluation. When you do see that patient, conducting an evaluation can tell you where they are um, for conducting a treatment plan, which is my next thing on this list. So developing a treatment plan, each patient is different. The plan that you make is going to be dependent on what happened to the patient, what the patient's going through their past. This can be from reviewing the medical history or conducting an evaluation. And you're going to rehabilitate them through ADLs or activities of daily living. These include things that we really don't think about, like tying our shoes or brushing our teeth or making breakfast. And this incorporates using fine motor skills, which is something that occupational therapists do. That's pretty much their job, is to focus on fine motor skills. So who do we work with? Everybody has a superior, and in this case, it would be an occupational therapy supervisor. This might be somebody who's been an occupational therapist for several years, or maybe it's someone who has a doctorate degree. Um, Typically, an occupational therapist would have a master's degree. You also work with occupational therapy assistants. They work directly under the occupational therapist, and they do more of the physical part. They may ambulate the patient or um, assist in range of motion exercises. I listed healthcare professionals. Doctors, these are going to be the high level healthcare providers that you really need in any type of healthcare team to prescribe medications to the patients. There's a vast number of reasons why a doctor could be beneficial in any healthcare team. A mid level healthcare provider could be a nurse practitioner or a physician assistant. This is something that you're going to see more in a hospital, working with any type of rehabilitation therapy. You're definitely going to be talking to mid-level healthcare providers about what's going on with the patient. I also included rehabilitation therapists. This could include physical therapists, speech language pathologists, just people that are going to probably be working with the patient as well, depending on what's going on with them. And maybe it's something that includes both of the therapies, both of the different types of therapists. And then lastly, I included nurses. And this goes back more to the hospital as well. So the nurses are going to have more face time with the patients than a doctor or a mid-level healthcare provider. So they're definitely going to be able to tell you what's going on with the patient throughout the day, how they're feeling, what they can do physically. Daily duties include examining patients. You're definitely going to have to see where the patients are, and then this goes into developing the treatment plan. So after you see how it's going with the patient, then you can more properly develop a treatment plan that's going to fit that patient. Um, and this is more of overseeing patients' progress as well. Um, like I said before, as time goes on, each patient is different. You make this special plan for a patient. Depending on how fast or how slow the process is taking, you can shorten or lengthen the treatment plan or change it. And you could work directly with patients too, being an occupational therapist. Uh, Maybe you want to educate the patient on doing something that they could do on their own at home. This is definitely something that an occupational therapist would do. And like I said before, just treating each patient differently. Each patient has come in for a different reason, so it's definitely important to treat them accordingly to what they're going through. I included a timeline. I started out with 2018 because it still is 2018. So I started out with completing this fall semester with at least a 3.5 GPA. Going into 2019, completing my spring semester also with at least a 3.5 GPA. And then also taking the GRE and obtaining a competitive score to get into different types of occupational therapy schools if possible. In the summer of 2019, finishing my last semester and ultimately graduating with my bachelor's degree in health sciences, and also applying to OT school for spring 2020 admission. In 2020, moved me down to the University of St. Augustine and beginning my first semester of the MOT program. in 2021, continuing my education and hopefully maintaining satisfactory grades. And into 2022, this summer, graduating with my master's in occupational therapy, completing and passing my board exam, and ultimately getting a job in the field. So, educational requirements, every occupational therapist has to have a bachelor's degree. GRE scores, I've seen different sites, but typically it's around a 295 combined for verbal and quantitative. And then you definitely need a resume. So each site that you go to for different schools usually requires you to have some type of resume. And then with the bachelor's degree, you really just need to have adequate scores, GPA wise, usually around a 3.0, probably around like a 3.3 or 3.4 to be more competitive. And each school varies with volunteer hours, but at the University of St. Augustine, they would require you to have 80. And then you, of course, need a master's degree from an accredited program of occupational therapy. Certification and licensing, like I said before, you would have to take the board exam. And to have a license, you have to pass the board exam, and you also have to have completed a master's program in occupational therapy from an accredited institution. Continuing education, the Board of Occupational Therapy was a good site to use. They included different types of hours that you would need. So you would need, I think it was 20 hours for general hours, and this is just general education, just to make sure you know what's going on, just because the medical field's always changing. Prevention of medical errors, and laws and rules. And what's next for me? I plan on graduating from USF. I want to stay at Moffitt as long as I can. Working with occupational therapists is it's really cool, and it definitely um, helps me to see what's going to happen going forward. Job prospects, um, looking at multiple sites, especially the University of St. Augustine's site, looking at their graduation rate and then seeing their employment rate. It's around 97%, so I think I would have a pretty high chance of getting a job out of OT school.